Hello and welcome to The Struggle is Renal, Kidney Health and Disparities, a webinar brought to you by Sierra Donor Services and UC Davis Health to celebrate National Kidney Month. Thank you for joining us today and being a part of this important conversation. I'm Kyla Aquino Irving, External Affairs Director for Sierra Donor Services, and proud to be a two-time kidney transplant recipient. In the United States alone, there are more than 88,000 people waiting to receive a kidney transplant. California has the longest waitlist in the country with over 20,000 people waiting and 88% waiting for kidneys. People of color make up almost 80% of California's waitlist, yet communities of color in our region have lower authorization rates, meaning we are less likely to say yes to donation. Today, we will learn more about the struggles and solutions regarding kidney donation and transplantation in our communities, hearing from our healthcare partners, local community members, kidney donors, and transplant recipients. Today, we will shed light on the challenges faced by those waiting for a kidney transplant, as well as the importance of giving the gift of life through organ donation. We hope this webinar will inspire viewers to take action and register to become an organ and tissue donor through sierradonor.org. So up first is someone who can speak about receiving the gift of life twice, Lauren Meeks Harris. Hi, Lauren. It looks like you're on mute.
Yes, I am muted myself.
No problem. So, Lauren, I actually know you. We grew up as teenagers together, and I know that you were just a teenager when your father gave you your first kidney. And tell us more about the second kidney donor. That one I think is a fascinating story.
Well, the young lady, she is still living. She lives in the Virginia, kind of more they call it the DC area, DMV area of DC now, but she was originally from the Sacramento area. And how we initially met was I was an after school, won't say coordinator, but like a teacher assistant for after school programs. And her mother wanted me to speak with her. We happened to be at a picnic, and she asked everybody, "Oh, what would you like?" And I said, "Well, I need a kidney." And she stopped. And then after we were talking, I realized she was the young lady that her mother, who was a teacher at the time, wanted me to speak to her about not dropping out of college. And then from there, I explained my story and how at the time, I know you have online studies and I've done online classes, but you still have to check in. And in my particular case, dialysis was taking, I would say, a good majority of my time to even be able to sit in front of a computer screen. And every case is different. But in my particular case, some of the classes that I needed to take were more hands-on and needed to be in person at the time. So the young lady, it seemed very sympathetic, and she kind of said, "Well, I'll give you my kidney after I graduate." Well, I thought, okay, yeah, right, because I know I had cousins, and as you know, Kyla, I had friends and other people who did go and test. My own mother went and test. They had ruled her out because of her background with kidney stones. And so I reached out to cousins, other people, and even neighbors tested.
Wow.
And this young lady actually was on the 5-point scale. She was a 4.5. She ended up donating her kidney to me. No relation.
Amazing.
She graduated from Cal State Sacramento. It was like December of 2020, not 20, excuse me, 02. And then we were on the operating table at UC Davis Martin Luther King week in 2003.
Wow. And look at you now.
Exactly.
That's amazing.
This
So,
lady was able to have children, if anybody,
oh, that's wonderful to know. Yeah.
even though she was a recipient, she has a couple of sons.
Even though she was a living donor,
Yes, people
even
are
though she was
still
a living
able.
donor, she was still able to have children. That's
Yes.
amazing. Wow. And so tell us what you've been able to accomplish or even enjoy in your life since the transplant.
Well, since the transplant, currently I'm working as a legal specialist. It's just similar to a paralegal.
Right? Yeah.
And I admit I've been able to travel and go see different parts of the country, been overseas. I would say some of my highlights include interning at the White House and interning for a prominent California governor who's also been in the movies. But I've had some very moving experiences and type of thing. So it's been good, and
Absolutely.
also to meet other just everyday people.
Yeah. I know that it's such a night and day experience, right? Before you get your transplant, you are probably the sickest you'll ever be in your whole life. And then almost overnight, right? You're completely different and healed, so to speak. And it's amazing what a miracle a transplant is.
Yes, it gives you a second opportunity, and if anybody has any doubts about donating an organ transplant, think about, would you give yourself a second chance?
Exactly. I was going to say, I'm going to ask you, what would you tell someone who's on the fence about becoming an organ donor?
Well, I would say, would you like for somebody to give back to you if you were in the same position?
Exactly. Exactly.
That's the biggest thing. And the other thing is for people, what do you want your legacy to be?
Mm,
What do you want to be known? I won't say it necessarily known for, but
right.
I mean, people will remember, and not just what people remember, but what do you think of yourself?
Mhm. I think
Would
that's
you do the same thing for your fellow person?
right. Well, I thank you so much for joining us, and I appreciate that you're sharing your story so graciously. And congratulations! I know you were in school to be a paralegal, and now you're there. So I commend you, and best of luck. And we hope to stay in touch.
Yes, definitely.
Thank you so much, Lauren. The need is prevalent in our country, our state, and our region. Up next is Leimomi Mabanta, a woman diagnosed with polycystic kidney disease, currently waiting for a kidney transplant.
My name is Rhoda Leimomi Mabanta. Everybody calls me Lay to make it easy. I am from Elk Grove, California. I knew I had CKD. I was diagnosed with CKD, chronic kidney disease, about 2 years ago, but I didn't understand the progression, and nor did I even understand. I don't know if I was in denial or understood what that meant exactly and where I would end up. So in fall of last year, 2022, I was diagnosed with needing a kidney transplant. I was stumped. I couldn't believe it. I heard everybody else getting one, needing one, but I didn't know it was going to be me when it came down to it. And after about 48 hours, I immediately went into action because I didn't think that I was going to sit there and let somebody decide my fate. I was going to do everything in my power to go out there and tell my story, be transparent as I can, and hopefully, that would bring me a kidney. On the road since I was diagnosed, I've been on a roller coaster. One moment I'm fighting and I'm happy, and the next moment I'm depressed and I'm defeated. And it's been like that since fall of last year. It's only now that I'm starting to kind of level off a little bit and accept. Once I started to accept that this is where I'm at, I started to clear my mind a little bit more, and I put together a plan. Now, my journey has been probably the same as a lot of people. I went looking for a living donor. There were quite a few of my friends that signed up with the UC Davis Transplant Center to try to see if they were a match, but due to either medical issues or past smoking and drinking habits, or because they were overweight or underweight, it disqualified them, which meant that no kidney for me. I know that it's a cliche thing to say, you can really save somebody's life, but when you really, really think about it, without the cliches and without the stigmas of society, whatever it is, any doubt that you have, guess what? You're really going to save somebody's life. And just knowing that, that would, like, for me, fulfill a purpose of why you were even on this earth.
Wow, Leimomi, we are all pulling for you and hoping that you get this kidney transplant that you need soon. Right now, there are more than 18,000 people in California like Leimomi waiting for their chance to receive a kidney transplant. 2 ways that you can show your support right now. One is visit sierradonor.org to register as an organ, eye, and tissue donor. And 2, if you are inspired to learn more about being a living kidney donor, visit livingdonationcalifornia.org. Next, I'm honored to present one of our partners in saving and improving lives throughout the California Capital Region, UC Davis Health. We are delighted to have with us here today Melissa Bean, the Executive Director of UC Davis Transplant Center and a living donor herself. Welcome. Thank you so much for joining us, Melissa.
Thank you, Kyla. It's great to be here.
You know, I love that you are not just the head of transplant there. You practice what you preach. You became a kidney donor yourself.
Yes.
I think that's amazing. But
yes.
Before we get to that, I wanted to ask you what your transplant center does.
The Transplant Center is a group of professionals that, are there slides? Yes, there we go.
We got you.
Thank you. It's a service line that provides transplant care to patients. It's a pathway. It's a pathway to transplant, and it includes many professionals. Transplant is the ultimate team sport. It is never about one person. I've always felt it was a great privilege to be involved in any part of the transplant process. As a nurse, I'm a nurse by training, and I was a nurse coordinator. And now I feel very privileged to be able to lead this team of professionals. So that includes the transplant surgeons, the transplant nephrologist, which is the kidney doctor, the RN coordinator, social worker, registered dietitian, pharmacist, and medical assistants. So it's an incredible team that helps walk the patient through this journey. And the patient journey essentially consists of 4 parts. One is the evaluation, and that's the entry into the transplant center. And that happens as a result. Usually the general nephrologist sends us a referral. And then a very comprehensive, it's like the most thorough physical you'll ever have is conducted. And then if all goes well, if the benefits outweigh the risks, the patient is listed. And that, I call that the hurry up and wait phase, because there's a lot of urgency around getting that evaluation completed and then getting a decision and then getting listed. And so that wait time is hard. That's a rough time for patients. Yeah. And then whether it's a living donor or deceased donor, the patient gets a transplant, and then we follow patients after transplant. Here, and we see about we follow about 2,000 post-transplant patients here at UC Davis, and yeah, it's an incredible it's a privilege to be able to see what can happen. You know, it's really a miracle of modern medicine. And Lauren mentioned second chances, and that is one of the things I love about this work, is that it's really the realm of second chances. And who of us has not needed one of those?
And that's a perfect segue to just learning more about how you came to be a living donor yourself.
Yes. So I came to transplant actually by not directly. I actually was an ER nurse. I fell, broke my right arm, and then I had to get a desk job. And so that desk job, there was a nurse coordinator, and that's been over 20 years ago. And so for many years, I had spoken. You know, I did public speaking about be a donor, and then and I always intended. I had this underlying intention. And then in 2008, I have a friend, Risa, who is pictured here. She's the recipient of my right kidney, and it was really intention meets opportunity. And so I've learned so much from Risa. She had polycystic kidney disease and taught me a lot about the struggles that that Lauren was describing about, getting a living donor and even initiating that conversation. She taught me a lot and continues to teach me a lot. She calls the kidney, my kidney, Mac, Melissa's amazing kidney, which
I love it.
Okay. And so I get these little messages. Mac says hi. But we celebrate a kidneyversary every year. And this year will be 13, a kidneyversary 13. And we're both doing great. Yeah. She's doing great. And one bonus has been that she has, in expressing her gratitude, I didn't plan this and certainly didn't ask her to, but she has done a lot of patient advocacy work about educating patients and how to have that conversation about pursuing a living donor without the ick factor, without it feeling,
Yeah,
and
absolutely.
so, yeah, it's just been a wonderful journey. It's one of the best things I've ever done. So to anyone who's considering it, I'm certainly happy to talk to anyone about. I would absolutely do it again in a heartbeat. It's been a great chapter in my life, and it also, in addition to working in the community, now I'm part of the community. It's really, yeah, it's more than what I do for a living. I really believe in this work.
Now, I will give you a warning. They do say that the kidneys have memory, and so she may be an advocate because your kidney is influencing her to be more active.
That's right.
Yeah, luckily for me, I got kidneys from my parents, so I'm just slowly becoming more like my parents.
That wasn't going to happen anyway, of course.
I know. I was in for it anyway. But do you believe that your personal connection, I mean, I think it's pretty obvious, being a living donor gives you a different perspective on the work that you do?
Absolutely. Absolutely. And I really, speak out. Patients who are waiting need a voice. And that's one of the things that Risa has been just so good and consistent about, being an advocate in the community. And so we speak together. We've done some joint speaking engagements, but it's such a humbling, knowing that I've made an impact in someone's life.
Wow.
As a living donor. And I would say the gift is also to me. It's not just because it's not just a one-way gift. I feel very privileged and really blessed that I've been able to do something for someone else. And, people have at times, what made you decide to do that? And I think for me, it turned into a question of why wouldn't I? This is really what I've been doing. At that time I'd been in transplant for about 15 years. And, why wouldn't I? I'm healthy. I have two. And our creatinine is both of ours is really good. Hers is 0.7, mine's 0.8.
And the creatinine is what measures how healthy your kidney is doing, right?
Yes.
Yeah.
And lower is better. And
right.
so we're both within normal range. And so why the question at one point just became, why wouldn't I? So yeah.
I wish more people were like you. So hopefully this talk will encourage others to be like you. Well, Melissa, thank you so much for the work that you do at UCD to save lives. And thank you for giving of yourself to save a life and lending your voice to encouraging others to do the same.
Yes, it's my privilege. Thank you, Kyla.
Thank you. Next, let's hear from Elizabeth Artiega-Novoa, kidney and heart transplant recipient.
Hi, my name is Elizabeth Artiega-Novoa. I'm from Sacramento, but originally from Mendocino County. At 97, I ended up being on dialysis. It was very hard. It was a hard road, so difficult. I had my ups and downs, getting sick all the time, weighing 80 pounds. Then they had to take my parathyroid out, and back in 98, and I started having heart problems on top of being on dialysis. So they said, a doctor, that from all the tests they did, that I had 6 months to live and that I needed a transplant. Oh, that was very difficult to take it. Very. I'm not rich. We don't come from a rich family, but I was able to get a transplant, and that itself, it quite a while, for many years, until I ended up getting a staph infection, which was very unfortunate at the hospital. So I ended up losing my kidney in 2011, and also my heart, because I went into a coma. So that was another hard road I had to, deal with. And things were very difficult. I became very frail, sick all the time, in and out of the hospital, difficulty breathing again, heart being at 30%, but I kept going, did my best, and being out there in the community, positive attitude, whatever problem came along, is trying to deal with it and moving along. Because for me, life is very precious. It always has been. We lived a difficult life coming from Mexico, my mother working in the fields. And so we were right there along with her. 2018, I was told that, sorry, I could get another transplant. But I had to be able to be in good shape. I mean, I was weighing 80 pounds. I had to weigh 125. So I did my best, and I ended up being 125. So I went in for, the exams and everything. And the doctor said, well, it's going to take, maybe another 3 to 5 years. We don't know. And I go, well, as long as I'm on the list, that's all that matters. That's my hope. Well, not even 30 days later, I got the call. And I was in shock. I was silent. Doctor, are you still there, Elizabeth? I go, yes. I couldn't believe it. I was blasted once more with a heart and kidney. And the doctors didn't think I was going to make it through, especially at my age and everything that I had gone through. But I did it. And I'm here, and I'm going 4 years out. But, because of that, I've been married with my husband now almost 17 years. The honor of becoming foster parents once again and giving our love to another child, because I'm not able to have children of my own. So every day is a blessing. Every day. And I try to do my best to help others, give them back to the community, and be able to go out there in the community and, how important it is to become a donor. It doesn't matter, the race, if you're rich, it's because of Sierra Donor Services and other programs out there, becoming a donor, becoming a registered donor, that it's possible for somebody else to be able to be given the gift of life, another opportunity in life.
Wow. As you can see, Elizabeth is living her life. She is a busy mom on the go. She even did that interview from the car. So she's definitely living her full life, thanks to the generosity of her donors and the dedication of her healthcare team. Speaking of healthcare teams, I'm pleased to introduce Dr. Richard Perez, the UC Davis's Chief of Transplant Surgery. Dr. Perez is a talented transplant surgeon with over 30 years in the field. He's a pioneer in developing innovative transplant surgery techniques, and he's my personal hero. I have a bias towards transplant surgeons. They've saved my life and countless other friends of mine. So welcome, Dr. Perez. Thank you so much for joining us. I know you have a very busy schedule, so we're so thankful to have you on. I think you're muted. Let me see if I can unmute you. There we go.
How about that?
There we go.
Hi, so
hi, Dr. Perez.
of course,
Welcome.
Thank you. It's my pleasure and honor to be part of this symposium. As you know, I feel very passionate about this field and humbled to be part of it. So thank you for the opportunity.
I mean, we always hear about how you are everyone's champion. Transplants are just like the stars aligning themselves, right? I mean, it takes so much coordination between the donor to the recipient and ensuring that the staff is in place, the recipient is healthy enough to receive the organ. It's quite a feat, wouldn't you say?
Yes, it's in a sense a miracle every time it happens. Absolutely. Because the recipient has to be ready. They have to be ready to come to the hospital at a moment's notice. Once they're there, then we do a very, quick and thorough workup to make sure that everything that we knew in the past that made them a good candidate was still true. That they don't have any infections or any medical problems that would preclude the transplant. And then, of course, there's the coordination with the organ donation and having that happen, transporting it to the transplant center, and then making everything happen so that you can do the transplant with minimal time with the organ outside of the body. So there's a lot of moving parts and everything has to come together quickly.
And you at UC Davis do it so well. Well, I wanted to know, why are there so many people waiting for a kidney transplant?
Well, in a sense, it's one of those situations where you're a victim of your own success. Transplantation over the years has become more and more successful as we've perfected the surgical techniques and the immunosuppression drugs to prevent rejection. So because of that, we can achieve very high success levels, and that means that we can offer it to more patients. So over the years, more and more patients have been evaluated and become eligible for transplant. We're doing them in very young babies that are less than a year old, up to patients in their 70s and sometimes even older if they qualify. So that has resulted in more patients being eligible. We already have heard personally about the benefits of transplantation and how it's life-saving and transformative. So more and more people want to enjoy the benefits. And that means that there's more referrals. We have now over 100,000 patients on the waiting list nationally. And as you said, 18,000 for kidneys here in California alone.
Right.
So that's become an issue because as the number of candidates have grown, the supply of organs has not kept up. So we're seeing more and more patients that are listed, but not all of them can get kidneys. So it's been our goal, our mission, really, our vision, to try to make it happen to as many patients as possible. So doing everything we can to promote either living donation, as you'd heard Melissa's story, or to do deceased donor transplants in those who don't have a living donor. So it's a daunting task, but it's one that we very much we are very passionate about and try to make it successful in as many patients as we can.
And, because March is Kidney Health Month, people always ask me, how do you keep your kidneys healthy? And, this is something that I work with my nephrologist all the time. But I wanted to ask you, what can we do to keep our kidneys healthy?
Well, the answer is really simple, and it's just to live a healthy lifestyle in terms of diet, weight control, exercise, and good rest. The important thing about kidney disease is that the symptoms don't occur until the disease is very advanced. And so the symptoms that you might see in a patient whose kidneys aren't working are the kidneys not able to get rid of fluid, so you'll get fluid retention, you'll get swelling in your tissues, the toxins build up in your bloodstream, so you'll have a lack of energy, or it even affects your thinking. But those symptoms don't occur until the kidney has lost much of its function. The early part of kidney disease, in most patients, you don't have any symptoms at all. So that's why it's most important to be followed by your primary care physician. Even if you feel healthy and normal, a regular visit by your primary care physician is critical, because if the kidney has a little bit of decreased function, you can pick it up on a blood test, and you can intervene before the kidney disease progresses. So
making sure you do your annual physicals so that you can catch any sort of warning flags early, just like anything else, I'm sure.
Just like anything else. I like to say, what's healthy for the heart and the rest of the body is also healthy for the kidney.
Which makes sense. So what is the criteria people need to be placed on a transplant list?
Well, Melissa went over the actual workup, but essentially you have to be medically fit to undergo a major surgical procedure. So you have to have good heart function, no other problems with any of the other organ systems like the liver, the lung. You have to be free of infections, free of any type of suspicious cancer. And then you have to be able to take your medications regularly, be very meticulous about medical follow-up, because if you need to be on medications to prevent rejection of the organ, since it's not your own tissue. And if you stop taking those medications or change them, then you're risking rejection of the organ. So we want to make sure that patients are very stable in terms of their medical condition and their psychosocial condition, with a stable living environment and able to follow through and with their medical care. So as I said, as was mentioned, it's a complete and multidisciplinary evaluation with the surgeon, the nephrologist, the social worker, the dietitian, and we try to look at it from every perspective to make sure that when the organ is given, it's given the best chance of success.
Right. We want people to have their best fighting chance to have a healthy life.
Exactly.
I get it. I wanted to talk briefly about dialysis and how it works and how it affects people when they're on dialysis long term. So dialysis is how people are able to sustain their lives while their kidneys aren't working. So it's supposed to filter, correct?
Yeah, dialysis is a good option. It certainly is life-saving in terms of getting rid of the toxins and getting rid of the fluid that a patient will accumulate if their kidney's not working. So it's a reasonable option, but we know that it takes its toll on the body. There are two types of dialysis. One is when you use hemodialysis, or through the bloodstream. You're hooked up to a machine, the blood is taken to the dialysis machine, it's cleansed, and then it's returned to the patient. And that's done at a dialysis clinic 3 times a week, or it can be done in the patient's home maybe 4 or 5 times a week. But it is very, it can be very stressful to the patient because the blood is rapidly taken away and given back to the patient, and it can cause a lot of stress and energy loss, and that has its impact on the patient. The other method is when you place a catheter into the abdomen, into the peritoneal cavity. Fluid is injected into the cavity, and then it's filtered and then returned, and that happens more gently over a longer period of time, usually through the night, and then they don't need to do it during the day. So both
techniques can do that from home, typically, correct?
Exactly, they do that from home. So it allows for more independence, and a patient can work and travel, but it's still very cumbersome. And neither technique really replaces the kidney function as well as a transplant. And transplantation, usually in the vast majority of patients, both improves their quality of life, they're more energetic, they're more independent, and it also prolongs their life as well. So although dialysis is necessary for somebody with kidney failure, transplantation is always the preferred option.
Absolutely. Well, we wanted to just thank you so much for obviously being someone who saves lives every day. And I know that we call you in random hours of the night, and you are always there for us and for the community. And not just as a physician, but also as a speaker with us today. I really thank you for lending your voice and helping us spread the message about the need for organ and tissue donation. So thank you so much, Dr. Perez.
You're very welcome, Kyla. It's always my privilege, and we are working together as a team with you. We appreciate all your efforts so that we can bring transplantation to as many patients as possible. Thanks again.
Thank you. Well, hopefully there will be many. Well, we want to thank Dr. Perez and Melissa Bain for their insights and expertise, as well as Lauren, Elizabeth, and Leimomi for sharing their stories. I want to thank my production team, Gabby Espinoza and Thomas Perry. To our attendees, thank you for your participation and engagement in this important conversation. It is through these conversations like these that we simply raise awareness and talk about the importance of kidney health and organ donation. We hope that everyone who joined us today will consider registering as an organ donor and continue to learn more about this issue. We encourage you to sign up by visiting sierradonor.org to register as an eye, organ, and tissue donor. Today, make the choice to say yes to becoming a donor at your local DMV. And please stay tuned with us. We have several events. Next month is Donate Life Month. April 3rd, we have a Light Up Sacramento event, as well as the documentary Joe 238 will be on PBS throughout the country, and we will host a launch party on April 11th. So be sure to follow our social media, check our event guides as well, and be sure to register and join us for these events. Thank you again for being part of this conversation. We really appreciate all of the medical and health professionals who do the work to save lives in our region, improving kidney health and access to life-saving transplants. Thank you from Sierra Donor Services.